Skin cancer is the most common cancer in America. The face is the most common area where skin cancers are diagnosed and treated.
The most common skin cancers we see would be number one, basal cell skin cancer. They usually present themselves as a shiny, clear, somewhat pearlish gray lesion. Usually it is not bleeding. It's usually very round and dome-shaped. The second most commonest form of skin cancer is called squamous cell skin cancer, and it approximately makes up about 15% of skin cancer. About 75% of skin cancers are the basal cell type. The good thing about it is these usually do not spread inside the body, and usually they grow by direct extension.
How common is skin cancer? I've heard that it's perhaps the most common type of cancer in the United States right now.
It is the most common type of cancer. Because it is so common, we don't even keep great records about it. We do keep good records about melanoma.
Melanoma can become a life-threatening disease. It's important that if you see a dark mark, if you see something that starts bleeding, if you see a change in a mole, either by change in size, bleeding, or pain, that you seek care with your physician.
Skin cancer is unfortunately becoming such an epidemic now, and we have really seen that the cause of skin cancer oftentimes can stem from early exposure to excessive sun, even in your teenage years, especially in your teenage years. That can give you a cumulative lifetime risk of having an increased risk of skin cancer. And there's so many different types of skin cancers out there. Squamous cell cancer, of course, a very frightening one, melanoma, as well as basal cell carcinoma.
Usually the sun damage is caused by the ultraviolet rays of the sun penetrating into the skin, affecting the skin cells, therefore causing them to age and change in numerous ways.
The culture used to be to stay sun protected, say in the early 1900s. However, with the advent of Coco Chanel and the tan, who made it quite popular, people feel that sun exposure, a tan, is a healthy thing. So people are getting much more sun exposure than in the past.
More than 2 million teenagers tan every year. And indoor tanning lamps emit UV radiation that can be up to 15 times stronger than the sun.
Treatment typically consists of excising the skin cancer. Because of this, oftentimes a defect is created in the face that needs reconstruction.
My specialty is the reconstruction. Although I can excise the cancer, oftentimes I work in collaboration with a specialized other type of surgeon, a dermatologic surgeon, known as a Mohs surgeon. A Mohs surgeon is spelled M-O-H''S. It's a special type of surgery where the specialized dermatologic surgeon will excise the cancer in a saucer fashion, cut it into 4 sections or so, all color labeled, and then evaluate exactly where the cancer is, and then take out further cancer from the area that still shows that there's cancer cells there.
Usually for any of these skin cancers, the initial treatment would be diagnosis, total body examination. A small piece of the growth would be removed in a biopsy-type procedure, and then once the pathology report would be returned, a determination would be made what would be the most appropriate type of treatment that would be carried out, and then the decision would be made how to treat it then.
Let it bump though.
Cleveland Clinic.
Before you head outdoors, consider this. The Centers for Disease Control reports the number of skin cancer cases is increasing. In fact, more than 1 million cases of basal cell or squamous cell cancer will be diagnosed each year. And that has researchers looking for unique ways to treat skin cancer. Do you lay out? Are baking and frying what you do to your body? Experts say today's tan may be tomorrow's serious health problem.
The ones I see are right up in here. They're just a bunch of little tiny red dots, and there's a lot of them up there.
The sun damage on Malcolm Cuddy's head may be precancerous.
Okay, so this is just a little vial with the medication inside.
This clear medicine called Levulan is being painted on spots that may be precancerous lesions. Ironically, the medicine makes the lesions highly sensitive to light, in this case, a blue light, which activates the drug.
We want to destroy as many of those precancers as possible, because 10% of them left untreated can eventually change and evolve into a skin cancer.
This relatively painless procedure is called photodynamic therapy.
2 minutes.
Cleveland Clinic researchers are trying to improve on this technology. They are examining how artificial skin responds to different doses of medicine, hormones, vitamins, and light. They want to know if a modified type of photodynamic therapy can work on potentially serious skin cancers called basal cell carcinoma and squamous cell carcinoma.
That are a little bit deeper in the skin, the ones that are actually more dangerous to the patient or potentially more dangerous, that we can have those as effectively treated with this light drug combination.
A treatment that wouldn't involve surgery or leave a scar.
Okay, let's see.
Malcolm is making sure his sun damage doesn't get worse, and he's making sure his family knows baking and frying should only happen in the kitchen. Sharon Dennis reporting.
Quite a sunburn. Don't you know sun can be dangerous to your skin?
Why is the sun bad for my skin?
Oh, Timmy, you dumbass. A sunburn is a sign that your skin is damaged. This damage increases your risk of getting skin cancer.
How do I know if I have skin cancer?
A monthly skin check can help you find skin cancer early. When you look at moles on your skin, use this easy-to-remember acronym. Echinopus. A, asymmetry, or the shape of one side does not match the other. E, elevation of a mole above the skin having a rough surface. C, color is uneven with shades of black, brown, and tan, or areas of white, gray, red, pink, or blue. D, diameter of a mole larger than 1/4 inch. B, borders on a mole that are blurry or jagged.
What should I do to protect my skin?
You should use the State Sun Guidelines. Stay out of the sun from 10 a.m. to 4 p.m. Use sunscreen every day with at least an SPF of 15. Protect your body by wearing a long-sleeve shirt and pants, sunglasses, and a wide-brimmed hat that's at least 6 inches all around. Now go out and have fun in the sun, Timmy.